So, really quick, we just have a couple announcements. Actually, not really. We do have our epidemiology update. We also have two members of the youth and school community team that puts on these school health update calls, who will be joining us on our team. So you'll be seeing them next school year. We also have a oral health presentation by our friends over at Oral Health. And then lastly, we want to get a little bit of feedback from y'all. So with that being said, I'm going to go ahead and move it over to epidemiology. Okay.
Hello, everybody. My name is Eliana. I'm not Jake. I've been on this call before, and Jake is out sick, so I'm covering for him. But I am one of the epidemiologists in our epidemiology division at the health department. Another one is Jamie. And between the two of us, we'll be giving you some epi updates for today. Next slide, please. Our agenda, I'll cover a very quick and brief respiratory update as we exit respiratory season. And then Jamie's going to have for you some very good information on a heat youth update. Next slide, please. This slide should be familiar to you. We are on week 16 of our respiratory season. This data covers through the the second week of April going into the third week of April. And as you can see on the slide on the left, the pink bars show the number of RSV cases that we've had since the beginning of respiratory season, which began back in October. And we're seeing a large decrease from our peak, which took place as usual on between the last week of December last year and the first week of January this year. People 15 to 64 years old continue to be the most affected. And the second most oftenly affected group are kiddos 1 to 4 years old. Last week, we only had 3 cases of RSV, and by last week, I mean week 16, so a couple weeks ago, really, which is almost 73% less than the week prior, so definitely a decreasing trend. Next slide, please. For our COVID-19 yearly report, we always report out on the full calendar year. So this graph looks slightly different from what the previous one looked like. But we are also seeing a decrease in our reported COVID-19 cases. This week 16, the last one we're reporting on, only had 128 cases, which is 20% less than the week prior. So this is on par with what the state is reporting, and hopefully it's marking the end of this current respiratory season, or the peaks of it at least. Around 50% of all COVID-19 cases continue to be people in the 19 to 44 years old group. And we have not seen a change of that in the most recent year. Second most affected group continues to be kiddos between 5 and 18 years old. And I don't think I have any severity data, but our hospitalization trends are also decreasing due to COVID-19. Next slide, please. Last but not least, for influenza, for our seasonal report, so back to the beginning of flu season being October 1st, we also saw the peak last week of December, first week of January, and we are also seeing a decreasing trend of flu here in Pima County. People 19 to 49 years old are the most affected by flu, and this is about a third of all flu cases in this age group. Last week, so this is the second week of April, we only have 26 flu cases or reported flu cases, which is already 41% less than the week prior. So once again, a decreasing trend here. Next slide, please. Just one last slide to summarize all our respiratory trends. Flu, RSV, and COVID-19 are decreasing here in Pima County at different rates. But if you want more information, in your slide is our most updated respiratory illness data, wherever that cursor was just. And next slide, please. We always like to include this slide just in case communicable disease, you have any questions. This is our current communicable disease reporting information for school partners. In case you need to refer to it, I always like to leave that slide in there with the link to ADHS. Next slide, please. Additional resources, we always leave this in here, so I'm not gonna spend too much time on that, but I can take any questions if you guys have any. If not, I'm gonna pass it on to Jamie for her heat update. Next slide, please.
Hey everybody, thanks Eliana. So I'm Jamie, I'm the environmental epidemiologist at PCHD, and since today marks the beginning of heat season, just wanted to give you all some information about it related to heat and youth. Again, today's the first day, so I don't have too many numbers to actually show you all, but just some good information and resources should you need them. So first I wanted to talk about heat and youth. Children are disproportionately affected by heat because their bodies do not regulate temperature as well as adults do. And children may not have the knowledge or resources to be able to protect themselves during an extreme heat event. So there's some specific suggestions for how to help protect young children or children in general when we're experiencing extreme heat events. So make sure to dress them in loose, lightweight, and light-colored clothing. Have them drink plenty of fluids and stay away from too much sugar. Stay in the shade as much as possible and take breaks. Try to move outdoor activities to cooler parts of the day. And if you're inside, it is recommended to use fans, but not above 90 degrees Fahrenheit. So all of this goes for kids as well as adults. Above 90 degrees Fahrenheit, you don't want to be using a fan indoors because that can actually increase your body temperature. Next slide, please. So here's a little bit of data from last year looking at age groups of those that visited hospitals for heat-related illness. You'll see on the left side of this graph, we have the younger age groups, less than 1 to 14, and 15 to 19 years old. So those school-aged children are making up only about 6% of our Pima County hospital visits. But that said, it is likely that there's a lot of heat-related illness cases that don't end up in the hospital because sometimes it's just taking rest and drinking some fluids and not actually having to go see a doctor. So our data shows 6%, but I wouldn't be surprised if there are more cases than this than what we have tracking in our data. Next slide, please. Okay, another group that is disproportionately affected by heat that might cross-section with schools is athletes. So athletes are disproportionately affected because they're regularly doing physical activity outside, sometimes in direct sunlight, and oftentimes they might be wearing gear that tends to trap heat. And furthermore, since athletes are expected to push themselves, it might be harder for them to kind of see the line between I'm just working really hard and my body's tired versus now this is a situation where I'm experiencing heat-related illness and I need to take a break. So some recommendations for athletes in heat. Again, limit outdoor activity to the cooler parts of the day. Make sure that they're wearing and reapplying sunscreen. Make sure to pace activities, so start slow and pick up the pace so that people can adjust to the heat. Drink more water than usual. They always say that if you feel thirsty, that's too late. You need to be drinking water before you are starting to feel like you need to be drinking water. And make sure that you have someone to check on you. So make sure that you're looking out for your teammates and your teammates are looking out for you. And lastly, if this is feasible for the sport that you're doing, wear loose, lightweight, and light-colored clothing. Next slide, please. And the last group that I wanted to talk about are those with chronic health conditions. So again, this goes for children as well as adults. So people with chronic health conditions are more affected because heat causes extra stress on the body, and that might make their health condition worse. Specific conditions such as obesity, heart disease, and diabetes can increase one's risk of heat-related illness. And those that have a chronic health condition may also be taking medications that can increase your risk of illness. So that bolded here, if you guys get the slides and you click on that, it'll send you to an infographic showing you what types of medications can increase your risk to heat-related illness. Next slide, please. Okay, and then the CDC did recently update some of their recommendations for heat, and that included these two flyers here for specifically targeted towards children experiencing asthma. The one on the left is for younger children, so it's geared more towards their caretakers. The one on the right is geared towards teens, so giving them a little bit more of an active voice and how to protect their own health. So if you follow that link there, it'll take you to these two pamphlets. They essentially have the same information in them. Again, it's just geared towards a different audience. And the 5 steps that the CDC is generally recommending for heat and those with asthma: 1, stay cool; 2, stay hydrated; 3, check for heat-related symptoms. Know what heat-related symptoms to be looking out for. They also emphasize checking air quality, since poor air quality can exacerbate heat-related illness. And finally, make sure to have a plan. If you do have any medications, have a plan for how to make sure that you have access to them and that they are staying safe during an extreme heat event. So I won't go too closer into this, but that link is there if this is useful for you. Next slide, please. Okay. So here's just some general information. I really like this flyer from the CDC because it really lays it out, what symptoms to look for a heat-related illness, and then what to do if you have that heat-related illness. So I know there's a lot of information here. It's pretty clunky, but it's a lot of really good information. So I won't read through all of it for the sake of time, but I do want to point out a few of these that are pointed to with arrows. So between heat exhaustion and heat stroke, you'll see that heat stroke, it says high body temperature, 103 degrees Fahrenheit or higher. And then you might also experience hot, red, dry, or damp skin. Versus heat exhaustion, right below that, it says heavy sweating and cold, pale, and clammy skin. So I just want to point those out because it's important to know that you can be experiencing heat-related illness and not be sweating, because there does get a point where your body has no more water to release and to sweat out. So I think that, to me, was a surprising thing to learn. So I just want to point that out, that even if you're not sweating, you could still be experiencing heat-related illness, and you might be experiencing heat stroke, which is the most severe version of heat-related illness. Next slide, please. All right. So this is just some information on weather looking out to the summer, just so all of us can kind of get an idea of what to expect for the coming months. So that figure on the left is showing us the projected relative temperature for May. Anything in orange means it's going to be above average. Anything in blue means they're expecting it to be below average, our normal temperatures. So you notice down in Pima County, we're in white. So that means they're expecting May, the temperatures to be pretty on par with what we usually experience. That image on the right is very similar, except this is showing for June, July, and August, the sum of the peak of our summer months, what we're expected to experience in terms of temperature. So looking at the southern half of Arizona, you'll see we're kind of in that light orange range. So the National Weather Service is expecting us to have slightly higher than normal temperatures. So we can be looking towards a slightly warm summer this year in 2024. Next slide, please. All right, and this is a really important tool that I just wanted to share with everyone here. This is new. It is still technically a prototype. It's fully functional, but it might not be updated every day, but that's like one-off. So it's mostly reliable. And what this tool does is you can look up your zip code and it'll tell you what the heat risk is for that day. So right now, I think I looked this up maybe 2 or 3 days ago. The heat risk was minor. So that means that for the average population, we don't need to be worrying about heat, but those that might be more sensitive, that might have conditions or comorbidities like we talked about earlier, those folks might want to start paying attention. You'll also notice it has a section that says actions you can take to protect your health. So this is a really easy place to go to if you want to get information on what does it look like today and what steps do I need to take, as well as a forecast for the next few days. So there's a link on the slide here. Would highly recommend that anytime you're planning outdoors activities for anytime it's hot, take a look at this and just see what it has to say about the day coming so that you can best plan and best stay safe in the heat. Next slide, please. Okay. So yeah, these are just additional resources. I think all of these links were throughout the slides as well. The only additional one is that very last one. AZDHS does have some recommendations for schools and managing extreme heat. So that's the only additional link here that we hadn't talked about on previous slides. Okay, I wanted to open up the floor if there were any questions about anything I just talked about. Okay, great. I don't think I provided my email here, but if something does come up, I'm sure you can find me. Thanks, everyone. Oh yeah, epi@pima.gov.
Yeah, thank you so much. And we also too will have some time at the end if someone does think of any questions, they can put it in the chat. With that being said, I also want to, oh, I realized my camera's not on. Hello. Moving along, I just want to introduce our newest team members, John and Kayla. John is our tribal and rural school health liaison. So adjacent to my position, John will be working with us to help better serve Pima County in our rural and tribal areas in the TO Nation, as well as in like Aho, Y, and other places as well. So John has been with us. He actually was in the epidemiology division. He started off here and moved over. Um, and yeah, so welcome, John. The next is Kayla. Kayla is our health navigator. A feature that we're going to be rolling out next year for school health staff is a referral form process that like helps with like health indicators or the social determinants of health. So to provide the families that you serve with like a variety of things, anywhere from like housing to food security to any sort of things like that. Kayla's going to be assisting with that, and she'll be giving a presentation in the next school year about like what the benefits of things like that. So we're really excited to have them and to see our team grow. With that being said, I am moving forward with oral health. Andrea or Margaret, are you on the call?
Yeah, I'm here.
The floor is yours.
Okay, thanks, Christopher. Hi, I'm Andrea. I'm a registered dental hygienist and program coordinator with Cavity Free AZ. And it is sealant sign-up season. So we have the link to cavityfreeaz.org for schools to go to, and you click on schools apply here. It takes less than 15 minutes. After we receive the application, we will work with the health assistants, the nurses, office staff, or principals to schedule dates for the students for the education and clinics. We are extremely flexible and work with the school schedules. We provide the hard copy consent forms, but we also have digital consent forms to make it easy for parents. They can complete it on their laptop, their computer, or their phone. We are self-sufficient, bringing our mobile dental RV staffed with fingerprinted staff to the schools, parking right outside and seeing the children. This year, again, through Delta Dental Foundation, every child that brings back a signed consent form and receives an oral screening on the RV gets a goodie bag, but they also get to choose a new spin brush of their choice. This year was amazing. We had such a great turnout, and it's been a while to get back into the groove after COVID. And we're going to work really hard to reach even more schools in 24-25. So I look forward to hearing back from a lot of schools. I already have about 8 schools scheduled for August. And yeah, just fill out the application and get it back to us. Thank you.
Thank you so much. I appreciate it. So with that being said, we're going to move on. Is there any questions for oral health? Okay, seeing none in the chat. Again, we can answer as if you do have something coming up or someone is typing, we can definitely answer that. But the last thing that I want to bring to all of y'all's attention is that as our team is continuing to grow and as we're continuing to grow our capacities, one of the things that we want to be doing is that we want to be increasing how we're serving you and the best ways of serving you. We know that you all have very full plates, and for you to take 30 minutes to an hour out of your busy day to sit on these calls means a lot to us. So we want to continue to do that and continue to grow so that we can make it more accessible for you and other schools across Pima County. So we have a survey. If you want to click on this link on the slide, you're able to fill it out there. I will also put it in the chat. It shouldn't take no more than 7 minutes. Um, it's just to get an idea. It's completely anonymous. All we're trying to do is get a better sense of how we can support you all in the school health updates as well as our newsletter. And your feedback is very valuable to us. Um, so yeah, that is all I have for that. Um, with that being said, does anyone have any questions, comments, anything like that, either for our epi team, our oral health team, or myself? Okay. Well, seeing none, I again, this is our last school health update call. So definitely, if you do have any questions, please reach out to us. There's our phone number and there is our email. Again, and please, 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 I cannot emphasize the importance of filling out the survey. We'll also be sending out the survey in our last newsletter, which will be going out on May 6th, I believe. Yes, May 6th on Monday. So, please share it with other folks that, if you know any coworkers or anything like that who like wish to attend these calls but cannot attend these calls because of the time, we would love to hear that feedback so we can figure out how we can make it better. But with that being said, that's all we have. And, thank you so much for a wonderful school year. And I hope you all have a restful summer.